Testing 1, 2, 3. Testing 1, 2, 3. And recording. Okay, now we're recording. All right, so what I'm going to do is show you real quick. Hope everyone's doing okay today. There was a glitch in the assignment. Stick with the assignment that's listed here. I'm going to move this part of the assignment, which was the PowerPoint, move it into week 4. And this is really just a practice type thing, not so much a graded type presentation. I want you to get some practice if you haven't had practice, but also just to see where you are with that. This will be expanded on in week 6. So don't worry about it if you don't have it perfect. It's just a matter of getting stuff on the table to make sure we're okay. Now, before I go any further tonight, I got a new headset and just wanted to make sure everybody can hear me. Thumbs up. Okay. All right, good. Hopefully it won't give us any problems, but I think I got it. I think I got my microphone wet, which was the problem because the headset was working just fine. Can someone do a sound check for me to make sure I can hear you?
Can you hear me?
I can, thank you. All right, very good. Well, tonight shouldn't be that long. I've got, what's interesting is I was looking at what we had already covered, and because I retooled the course, my goal was to stay ahead of where you were going to be for the next week. So really, this material kind of goes along with next week's material, but it's also necessary for you to build your PowerPoint. So we'll start here, and I think that'll make more sense as you see what we do. All right, let me get the slide going. Where is my presenter? All right, so everyone can see my screen, correct? Okay, good. All right, now, so this says part 1, but really there's only going to, I actually combined part 1 and part 2 just today because I just decided it wasn't necessary to have 2 parts. So what we're going to do tonight is talk about, tooling those objectives. I answered some of your, well, when I responded to your discussion boards and your grades, I may have responded to some of you explaining that we needed to maybe retool the objectives. And one of the reasons for that is to get better, to target the goal a little bit better. Active learning, which is a concept in education, it's not, I guess you could call it a theory, but really what it is about getting the learner active in whatever they're doing. And, getting somebody to engage in whatever their educational material is the methods that you will be using, such as group work, discussions, whatever it is, something that gets their brain moving. Because the biggest challenge with any learner, depending on where you are, is to get them engaged. Without engagement, you can't reach your goal. So that's important. So I use a lot of sports analogies. I'm sorry. What can I say? So I look at, sort of goals, and this is, I don't know if I ever expressed this to you, but and I don't have it in the slide, but goals. What are goals? And I think everybody knows what a goal is, but for me, I always used to stress this to students was that goals actually could be an acronym for getting on with active living or getting on with active learning. So if you put it together, if you think about what a goal really is, you're going to set a goal, and generally that goal, if you go ahead and put it down on paper, is going to generate momentum within your brain to accomplish it. I mean, all of you are currently doing your master's program. You set a goal to complete the master's program. And I'm sure that when you set that goal, you probably decided, hey, you know what? I'm not going to give it up. I'm not going to give up. I'm going to keep pushing no matter how hard it gets, because you've implanted in your brain that goal is there and you're going to accomplish it. It's part of motivation. We're not going to talk about it tonight. I'm going to try to work it in, but I'm going to have to try to figure out the best way to do it. But there's a concept. Has anybody heard of motivational interviewing? Okay. What I might do is send an article I wrote on motivational interviewing in COPD patients, but it can be, so it's an educational type thing. So it can be utilized with patients, it can be utilized with students or even staff. I absolutely love the technique because you drive home, or what you're trying to do is elicit the motivation from the student and then act upon that by engaging them in conversation. And I think it's one of the number one skills that a respiratory therapist can utilize to do a lot of things in a clinical setting, whether it be with a patient or staff or students or even physicians. When I was in graduate school, we actually had a single course in motivational interviewing. So 16 weeks of doing nothing but that. And it really makes you rethink how to interview people and how to motivate the individuals you're working with. All right, so we talked about this, I think, last week. One of the things that we're trying to measure one of these questions: the what, the where, the who, the how, the when, or the why. We're trying to utilize all of our tools to get to that point. We also had discussed Bloom's taxonomy. We're going to dig a little deeper into that just in a few minutes. But just as a reminder, Bloom's taxonomy, this is the new version, 2003 version. The 1995 version, or earlier than that technically, would only go up to the evaluation stage. So be aware of that just from a technical standpoint in case you're ever questioned by a old school educator, because they will say that the top of the scale is evaluation. Well, when it came along and it was reevaluated, that next scale of creation was part of the next rendition of the Bloom's taxonomy. But if you put the Bloom's taxonomy in perspective, this is how we build everything. All right, so right now we have unit or instructional outcomes. That's within the course itself. So we have the course outcomes. Those course outcomes feed into the program outcomes, which are connected to the objectives of the program or the course objectives, et cetera. The program goals, the program mission, the school mission, and the university mission. The biggest challenge you'll have if you're an educator is when the Department of Education or COARC comes along with a new idea, and which they did a couple of years ago, actually many years ago now, and we had to do basically evidence-based student learning outcomes, and which was fine. We were already doing them, but we had to retool our entire program in order to do that. And so we were really struggling with it at the college I was teaching, but I volunteered for the committee because I had 7 healthcare programs. My fear was that they would give us something that we couldn't adapt to. So I volunteered to ensure that they understood we had programmatic accreditation and we had to hold the line on what those program outcomes were. So in order to do that, how do we build something in which something already exists without altering what COARC required? So it was easy enough to start with our program outcome requirements set aside by COARC and go downward. But see, some programs, actually the majority of the programs on campus, we had 58 associate degree programs. It was only the health science and nursing programs that actually had program outcomes established. And I have to brag on respiratory therapy as a whole, just because, well, it's our field. And so how many of you realize that that COARC, prior to that Joint Review Committee for Respiratory Therapy, established the guidelines and the gold standard for programmatic outcomes and evidence-based outcomes for education? Way back when I got started in education, Teddy, hush. One of the things that when I was okay, he's barking at shadows, is that we came to realize was that the majority of most campuses that we were working with, they didn't have any stated goals, program outcomes. They had course objectives, they had unit objectives, but they had no specific goal for the program. So therefore, they had no projected outcomes. How many people are you going to? What's the number of people you're going to get employed, graduate from the cohort? How many are you going to? How many are going to pass the boards? those are all things that we were already doing. And so we had program outcomes that were directed towards that. And over time, what was really interesting, I think it was, let's see, who was it at the time? I think of his name, it's been so long ago. But anyway, well, I can tell you that Dr. Burton was one of, I don't know if you're probably familiar with Dr. Burton, right? Hopefully. Dr. Burton, as we used to call him, the god of respiratory therapy. He wrote many of the early textbooks in respiratory therapy, and he would come to our conferences. And so he was big into accreditation and teaching and everything, but he was a pulmonologist and a wonderful guy. And he would just sit back and tell you, you know, as it was. And one of the things he was really stressing to us was how well respiratory therapy already had this in place. And I always got excited about that, because most of the time you hear about nursing or you hear about other programs or wonderful things they're doing, but the reality is nursing came to us when it was time to write their program outcomes. Radiology, all of the other programs came to us because we were already doing it. And you know, I would get comments from the administrators and they would go, well, gosh, y'all are already doing a great job. I hate to make you change this. And so in the case that I'm describing, you know, I volunteered for the committee and we made sure that we stayed on task. Our program goals did not change, but everything else we had to adapt, and we were able to come up with a solution, and I think it turned out really well. So anyway, everything has to connect, and everything ultimately has to connect to what the university or college mission is. So we said the who, the what, the why, and the what, all of that, and how has to be looked at. So we look at it as who's your audience, what's the behavior you want, what's the condition, or what the condition is that you or circumstances you're in, and to the D, to what degree and to what extent the criterion is met. So it's similar to what we would use with BLS, you know, that's sort of the acronym type things. You'll see a lot of that, just like in education, means something a little different. Now with the objectives, we want to be what we call smart with the objectives. And what I'll mean by that actually is this: you want them to be specific, you want them to be measurable, achievable, relevant, and time bound. I mentioned to some of you in your discussion boards responses that we need to make sure that you know, whatever you're doing has to be measurable. So I'm going to show you, if I can find it here just a second, I'm going to show you something real quick that I received. And you tell me if you think it's, so every day I get CE requests. And so we have to approve the CEs so I hopefully took out everybody's name who submitted this. Can you see the objectives here that they wrote? Do you consider these objectives?
They almost seem like a list of skills to be completed.
Exactly. So this person got an email basically stating that they had to reformat this to show that it's objectives. So participants, well, first of all, let's say if you tried to adapt the first one, transport policy overview. Okay, let's say you change that and made it into, they will understand the transport policy overview. Okay, that doesn't make any sense, right? So maybe they just, the participants will be able to understand the transport policy. Would probably be a way to rewrite that. Well, then the question is, how do you measure it? So the easy way to say, well, how do I measure that? I can do a Q&A, I can do, you know, a survey, whatever. You could do a polling. I don't know if you've ever used Poll Everywhere, if you've ever done a presentation, which is an electronic way of getting questions answered. And I think that's most effective in large group sizes because you get a lot of people, a lot of participation. Loading and unloading transporter stretcher. I'm sorry, I had to laugh when I read these. Because we were just talking about this and in class, and I thought, wow, this is exactly why one of the reasons that you're in, you know, this class is because it's funny, but it's not. I can tell you this person has 20 years experience in respiratory therapy, but that doesn't mean that you have the experience to deliver an educational program. Now you might say, well, it's easy enough to just redesign these and it looks good, and that's true. But the reality is if you're not focused on, you know, okay, I can say, I want the participants to be able to demonstrate that they can load and unload a transport stretcher. Okay, easy enough. I'm going to do that through observation. That's a psychomotor skill, right? So, but it has to be phrased that way so you know what you're measuring. Here's another one, and see if this is better. This is another one I received either yesterday. I think I received it yesterday. All right, so this has to do with their neonatal and pediatric skills up to date for the RCP exposure in the ED. Well, first of all, I'm not crazy about just doing these for updating skills unless it provides new information. But to enhance the learner's knowledge of NRP guidelines and how neonatal anatomy differs from adult. Okay, well, that's a better objective, but will participants be able to, all right, how are you going to measure their knowledge? Well, we can do that with the test. And we can also do how the neonatal anatomy differs from the adult. But does that sound like one or two objectives?
Two.
Right. You never want to have more than one objective in a line, because now you've got to rethink and say, well, and here's the thing. If you know the NRP guidelines and you can pass the test, you should be obviously you know the difference of the anatomy, correct? So it may not even be necessary to have that one, but if you want to put it in there, it needs to be on a separate line. To provide the learner with evidence-based therapies in the treatment of pediatrics of bronchiolitis and asthma. Now, of course, that's going to the general skills of a pediatric specialist. It's measurable. Can you say that, I mean, is there anything that you might improve upon with that one? I mean, it's certainly by far better than the one I showed you a few minutes ago.
It's not really specific.
Right, what specific do you want to, if you were looking at this, what would you think about, well, you are looking at it. What would you want to specifically know in the treatment of pediatric bronchiolitis and asthma? Is there something that you want to specifically measure? All therapies, new therapies?
Well, bronchiolitis and asthma aren't necessarily treated the same way. So again, I think that would need to be two separate, unless it's just going to be going on just like a medication. But
yeah, I mean, you could, I mean, I don't know how many of you have ever treated bronchiolitis with racemic epi before, as opposed to other type of bronchodilators. Most people think bronchiolitis, for example, you know, they have a different, completely different, obviously from asthma, completely different mechanism, but they both cause inflammation. And we used to treat bronchiolitis with racemic epinephrine, but we wouldn't use it on an asthma patient because it wasn't long acting. So, you know, and the other asthma medications really didn't hit bronchiolitis. But in any case, you're right. You really need to break these apart and have, you know, one for bronchiolitis, one for asthma, because they are going to be different. Now you could combine them, and as long as you had two ways of measuring those, I think you could get away with it. It's certainly better than the one we read before. And the last one is to increase the learner's knowledge of the Broslow system and how to utilize EBM in the resuscitation of pediatric patients. This one I have a problem with. Do you? My problem is this: how to utilize EBM in the resuscitation of pediatric patients. Well, that one is really, really broad. You can certainly talk about resuscitation in the pediatric patient and what the evidence is, but how do you utilize that? In other words, it's very confusing how they're going to measure that. If they can resuscitate a pediatric patient, you know, there's a specific skill that you're measuring. But how do you then say, well, they used evidence-based medicine in this case? And again, you're mixing two different objectives here, and that's always a big no-no when you're trying to do. And I think probably the reason they did it is because it was a quicker way to get it through the system, because they have to, the way our system works, they have to enter each objective on a different entry box. So maybe they copied and pasted, and you know, they felt like it was fine because they probably meant this to be two different ones, but it just came out this way. I'm going to give them the benefit of the doubt on that one. Let's see. All right, back to this. Okay. All right, so we're here. All right, so some of you did, and in fact, a really good job of this, breaking each domain down, so you have the cognitive, psychomotor, and affective domain. From there, you're going to have your different verbiage to measure or to write an objective. So you'll have one for cognitive, one for psychomotor, and affective. Now, if you're in education and you are a co-worker accredited program, you have to have at least 2 objectives per or outcomes or goals for each of these domains. That's generally the rule. Now, in this class, if you had 1 for each domain, that's fine. But just be aware that typically you have at least 2, preferably 3. Does anyone know why you want to have at least three objectives for each of these? And what's the purpose of the number 3? Anybody?
To maybe reach each person that has a different way of learning?
Possibly, but I want you to think about something. If you're doing a study, and you're trying to sort of get to a logical endpoint, would it be better to have 1 data point, 2 data points, or 3 data points?
I'll go again, 3.
Correct. It's called triangulation of data. In other words, if you don't have the three measurements, you have to have 3 objectives, but 3 measurements to see if you're getting to that goal. In other words, it adds more reliability to that you're achieving the cognitive goals that you've set, or the psychomotor goals, or the affective domain goals. So you can get away with 2, but it's better to have 3. So you arrive at an assessment that yes, they've achieved that goal. So for example, if you take the cognitive outcome for any program, you have a couple of measurement tools. You have the NBRC exam, correct? TMC. You also have the final exam of their capstone course. And maybe you also have, I don't know, maybe you did live one-on-one simulations to demonstrate your cognitive ability. Or maybe you did, you had your clinical people evaluate the students by, verbal, using the Socratic method, questioning them on the various aspects of whatever you're teaching. So you can utilize their assessment combined with the test results to see if they match up. If you get triangulation, the data should all point to that point that the student is cognitively competent in the material. Some students might excel at the cognitive testing and not so much on the questioning part. Because everybody's going to be, there's nervousness factor when you're getting oral exams as opposed to a written exam. The NBRC used to do all oral exams for the ClinSims. So you were brought before a panel of physicians and you had to answer questions. So you had to go, you had to go to Illinois. I think that's where it was. You had to go to Illinois and sit before the panel and they would ask you a bunch of questions about the cases that they presented. Could you imagine? So it was like doing rounds, but in this case, you're being graded and whether or not you get your RRT or not. That was the first rendition of the NBRC ClinSim exam. So exciting. So you can, I think it's helpful to do that because that's how when we graduated, the NBRC had stopped that, but our professors still utilize the same technique for our final exam. So if you're looking at the cognitive domain, you've got all of these definitions, the knowledge, comprehension, application, analysis, synthesis, and evaluation. Notice this doesn't go up to creation. But the reason I'm pointing this out is they have sample verbs for each one and a definition for each one. I'm not going to read them all, but it's important to think about the verbs. Don't just randomly pick them. Think about the verb and what it means. Is what's more appropriate. For example, if you demonstrate something, that means you're physically going to demonstrate an application, right? Versus illustration. Illustration could be done a number of ways. You could write about it, you could draw about it, you could demonstrate, I mean, you literally could illustrate it through, action. But, it's just a matter of how you want to envision what that domain should look like. In most cases, you're going to be going up to these upper levels and thinking about how would you get them to formulate new structures from existing knowledge and skills. Well, you've got all of these verbs. Now, the verbs seem somewhat benign as to why you would want to choose that, but when you start thinking about it, and hopefully for any of you I gave examples to, if you didn't get examples, you did a good job. But if you didn't, that's fine, because it's about learning these. But constructing or combining, designing, develop, and generating and planning, these are all things that you're doing now. You're synthesizing, you're evaluating. So you're going to be teaching down in this direction to bring them up in this direction. Same thing for psychomotor skills. They have a different set of verbiage, but we know that they're doing skills, what you can do, what you can physically represent. And there are a bunch of terms here. Again, these are just sample terms that you can utilize. What I don't think is a good idea, let me go back to this last slide here. And this is what I saw a lot. You would use just the first one in each of these categories. So I'd get a lot of define, describe, apply, analyze, combine, assess. So mix it up a little bit, because you'll find when you start writing them, it starts making a little bit more sense. Same thing sort of goes here. It's sort of similar, but again, the definitions, you need to be aware of what you're doing and why you're doing it. If you'll notice, the blocks at the very top are a little different. So you got perception, set, guided response, mechanism, complete overt response, adaptation, organization. Let's focus on adaptation. All right, so what's important is that you as a master student adapt to the new terminology, adapt to the new, the approach, right? And so you have to sort of maybe alter what you're doing to get to that point. And so that's why we're pushing you in this direction, because you want to bring people up to this level, but you have to be able to reach that level and perform at that level. Organization. Everything you're doing is about organization. You're designing a course outcome by developing a PowerPoint, developing objectives, developing your goals. You're composing what you're going to write. So all of these things are tools that you can use down the road. And then there's the behavior aspect. Again, it's defined a little differently when you look at it from the Bloom's taxonomy perspective. Receiving, responding, valuing, organizing, and internalizing. Internalizing is what you want to do. That's where you want to get. So can you defend what you're doing in your project? Because that's what you're going to do in your capstone, right? You're going to create your capstone, but then in your capstone presentation, you are effectively defending what you're doing or have been doing for the last 2 years. So these are some of the things you want to avoid. Not forgetting these steps, number one. Just go back to the basics. Who, what, when, where, how, what, all of those things makes it simple. And then making an objective that is unattainable. I gave you one that wasn't even written correctly, but could be virtually unattainable because it wasn't written. Can you think of another objective that might be unattainable? Any ideas? I should have brought one that a student wrote me one time. But just simply ask yourself, when you write an objective, say, okay, well, how do I measure that now? If you can't answer the question, it's likely unattainable. It should, in other words, when you write the objective, it should first come to you. Okay, this is how I'm going to measure it from a cognitive perspective. This is how I'm going to measure it from a psychomotor perspective, and then affective domain. Now, I'll tell you, if you teach for any length of time, you'll find that the affective domain is probably the hardest one to deal with. In what I do now, I deal with a a lot of affective issues, because everything that a violation that occurs in our practice it resides in that domain. It's usually not a psychomotor deficiency. It's usually an affective domain deficiency. And we have to help correct that in order to help people keep their license. So here's the interesting thing. One of the things that we'll do if we have somebody and every disciplinary action is a behavior problem. Okay. It seldom is a psychomotor problem. And although a behavior problem can lead to a psychomotor deficiency. And let me explain. We've had this happen a couple of times, but the first time it happened was we had a young therapist who was working at a very large facility in North Carolina. They average run 100 vents a day. So it was super busy. All right. And she was trying to get her work done, and she was called down. A patient of hers had been taken to CT, and somebody had I guess, or maybe, I don't know why she wasn't with them, but in any case, she was called to connect them back to the ventilator because they had come back from CT. I don't know where she was on the transport, but in any case, when she came back, I know what it was. She was actually helping another therapist out. So they called her down to help the therapist. And the therapist had to work with another patient. So she was helping this individual. So of course, it was at 8:40. And so she puts him back on the ventilator and walks away, and the patient dies. What do you think she forgot to do?
Take the vent out of standby.
That's exactly what happened. And that's happened a couple of times. So what caused that? Did she know how to take it out of standby? Yes. So it wasn't psychomotor deficiency. Her behavior was a little bit erratic because she was frazzled. She basically missed step one of any patient interaction. Other than introducing yourself, the first thing you do is what with every patient?
Reassess them.
And she failed to assess them, because if she had assessed them, she would have noticed that they weren't breathing, right? And she failed to do that. So there were a number of things that went on there. Of course, my question too was, well, where was the nurse and everybody else when the patient was dying? But it happened in short order, of course. The second time it happened, it was a male therapist that, again, sort of the same idea, but it wasn't that they had received them from CT. They were transporting them from the ICU to the hospice floor on a ventilator. And the hospital policy was to turn off all alarms when transporting the patient going to hospice. Well, guess what? They had checked the ventilator. The ventilator was ready to go. But when they had connected the patient to the ventilator, because none of the alarms were on, they failed to take that ventilator out of standby. The patient was transported for 20 minutes without ventilation because all alarms were cut off. No one noticed that the SATs were dropping. By the time the patient got to the unit and they were connected to the ventilator, they already crashed. The therapist had already left the room before that happened. So not only did they forget to turn it on standby, but a proper assessment was not done when they delivered the patient to determine that that patient was breathing and was stable. Now, of course, they were going to hospice, but that doesn't excuse the fact that this happened. In both cases, the patients died. And it was a consequence of a behavior that you get busy, you get frazzled, and you stop thinking. It does impact the affective domain. All right, so the objectives, writing objectives that do not relate to the goal, very common. So you get a goal, but the goal you look at the goal, you look at the objectives, and you go, wait a minute, what does that have to do with it? You get all sorts of confusion, particularly if you're talking about doing it. For example, if you're going to a conference and you're presenting something and you said, this is our goal for the lecture, and your objectives are, I don't know, you're talking about something completely different, people look at it like you're crazy. So always go back and read backwards to make sure it all lines up. And a couple of people did this, and I responded to this, describing what the instructor is doing rather than the learner. Now, you can have those types of objectives, but you have to discern the difference between what you're going to do and what they're going to do. So you can easily write objectives for yourself and then also write objectives for the participants. But you would never put that in your presentation. In other words, just as a matter of maybe practicality, you might say, this is what I'm going to do. Here are my objectives, and here are the objectives for the participants. That's fine. But by themselves wouldn't be objectives for the participants. So if you received a message from me regarding that, it's just about pointing you in the right direction, making sure you're writing for the learner, not yourself. And I think we've already talked about including more than one expected behavior in a single objective. You get too much to try to measure, and it gets confusing, and you just get overloaded with that. Cluttering objectives with unnecessary information. So having a preceding phrase before you even get to the objective oftentimes confuses things because people don't know what you're discussing. So making sure that it either begins with students will be able to, or participants will be able to, and then state it and be very simplistic with it. You don't have to go into a lot of detail. Now, as far as the goal is concerned, you might have to say the students will be able to set up and you can just generically put ventilator without prompting by the instructor. You could add that. Okay, and the reason is because that's a very specific objective to achieve a specific psychomotor skill, and you're demonstrating that they're doing it without assistance. Okay, and it just makes it a little bit more targeted and specific. Okay, so this is sort of where everything starts to come together. So now we have the objectives. We now implement the objectives. We knew what the present performance was. We identified the gap, and our objectives are written to get to that desired performance. And then at the point of where you're going to reevaluate, you may have to retool things because now you say, okay, well, wait a minute. They can set up the ventilator without assistance. The next plan would be they can set up a patient who has ARDS on a ventilator without assistance. That gets even more specific to a disease process. So you can always go back and retool those, but I used to like to write generic ones and then build upon those. I think it's easier. But this gaps analysis is really just the whole point of doing that is to identify what you've already done, where you want to go, and then how you're going to evaluate that. But you have to have the objectives in the meantime to be able to do that. The other part is being too general. This one tends to get people in other words, it sounds really good, the objective does, but then you read it and go, well, I'm not really sure that, I'm not sure that's going to be attainable because it's too general, because it's too broad. I'll give an example. Students will be able to understand respiratory therapy. Now, I know that's sort of silly, but that's a really general and unattainable goal in a course, right? Because could you imagine that being a first semester course objective? I mean, you would have to cover the entire field of respiratory therapy in a quarter or a semester. It's unattainable because it's too general. Can you think of any unattainable general goals that you might have heard or come across? No, just think about it. And I think it's important to go back to maybe some of the conferences you've gone to and reread some of those objectives. And you probably stop and think, well, so I'm terrible at conferences. I will go to a conference and I will sit there and I'll read I'm probably the only person that reads the objectives, but I'll read them and then I'll look at it and go, well, we can't get that done in an hour. Or then I start breaking down their PowerPoint. I'm like, why are you reading your PowerPoint? I can read, just let's talk about it, but that's the death by PowerPoint, which is in week 3, which is going to go to week 4. I think it's important to realize what people do and what they do wrong. And one of the things they do wrong is literally talk from the slide. I can read the slide. If there's something on the slide you want to point out that we need to discuss, that's what we should be doing. It's different in a large crowd, but it's still the same principle. You don't put more on the slide that you can talk about. If you've got a whole list of things, studies and all of this stuff, people just glass over. It's pointless. So hopefully that gives you an overview of sort of where we need to be going with this whole process. I wanted to leave enough time tonight for if you ask any questions that you might have had about the assignment for this week, and also to discuss a question that was asked of me this week, which is, do we want to move the class to a Monday rather than Tuesday to give you more time to work on your to give you a heads up on what you need to work on? So I'll leave that up to y'all if you want to chime in on that.
I actually have a question on the discussion forum for this week.
Okay.
So are we using, because it says to design objectives for the age group that we're producing our project for, and then either going a level up or a level down. So are we using the objectives we already created and then doing the level up or down?
Right. I want you to see how well you can adapt going up or down, because you have to rethink about, so if you're teaching to a patient group, then you obviously have to go up to at least a student level. If you're at a student level, a staff level. If you're at a staff level, down to a student level. So this way you can exercise I want to see your ability to retool sort of the same concepts so you can address different audiences.
Okay.
Does that make sense?
Yes, definitely. Thank you.
Okay. Any other discussions?
I have a question on the essay that's due.
Right.
And are we just building on the essay that we wrote for, say, this week and last week? That's what I did for this week.
Yes.
And now I kind of got confused. I thought, oh no, I hope okay, go.
What you want to do is, and this is how I would do it. So look at whatever prompts there are for the new week and add those prompts to what you've already done. Because what I want this to be is by the time you get to the end is that you've already written your paper. But you will have to go back and probably smooth it out a little bit, but you'll have the basic structure. And this way we sort of have this running tab of information. Now, if you don't want to include, I'm not asking you to include everything, but you can. If you just need to want to add the pertinent parts, that's fine, because the goal is to not write more than 4 pages of new material. I'm not asking for you to write 4 pages. I don't want you to write more than 4 pages every week. Okay, there's a difference. If I said you had to have at least 4 pages, that means you could write more. In this case, the reason I want you to do that, and the hardest thing to do, is to synthesize information into a very small encapsulated topical paper. I'll tell you a fun exercise we had to do. One of our courses in graduate school, we couldn't write more than 1 page for each paper. And we were given at least 10 sources we had to draw from, but we had to synthesize all of the information into 1 single page, including references. Do you know how hard that is? That is 10 times harder than trying to write 2 or 3 or 4 pages, because I'm a expressive writer, and most of my papers in grad school were 10 pages plus for every week, because I can't shut up, basically. I don't feel like I'm finished, but I was forced to do that. And I was very thankful, because in what I currently do, I have to be that way. And it forces you to think harder. So that's another reason I'm restricting it to 4 pages, because I want you to be succinct and specific. Does that help, Brandy?
Yes, absolutely. Thank you.
Uh-huh.
But we're not coming up with new paper every time, because I've been like retitling it and based on the weeks.
Let's look at, this is this week, right? Go to this real quick.
I'm retitling it just for what the module is saying for assessing
That's
that.
fine. That's fine.
But you're just adding to it, Brandy.
Right. So here's the things you have to add this week. So you got your 4-step appraisal, you're assessing learning needs, methods to assess learning needs, and what are the predicted motivation and barriers to learning. And based on your appraisal, incorporate how learning theory and styles of research will be used in your approach. You've already done some of that. You may have to retool it. But again, you're scaffolding this information. So some of this will be repeated, and that's fine. And the other thing it does too, you may go through it and think, I can do this a little bit better. So you rewrite it, and that's good too, because that's what you want to do. You don't want it to necessarily be exactly the same, but because you should see the areas that you need to maybe address, because in your paper responses, I've been giving you ideas of how to retool the papers. Hopefully you can see that when you open up the page, because I had to redo everybody in group 1 last week, and I didn't realize I didn't save it, so that was a real pain. But having to do that helps you see what you can do. So you encourage you to go back and look at those responses and say, okay, I need to maybe adjust, maybe shift this around a little bit. Because if you are a manager in a department, or you're like in what I do, I'm dealing with legalistic issues. Things have to be in such an order that people reading it from the public side can read it and understand it. And it's hard because you understand it, but I have to have a lawyer read it. I have to have the board chair to read it, and have my secretary read it, because I know what I'm thinking, but sometimes what I'm thinking doesn't necessarily translate on the page. So every time you go back to it, retool it if you need to make it sound a little clearer. You might see something you need to improve. You might want to change your objectives, because now you see my objectives that objective is not going to work. It's not measurable. So don't feel like you can't change something because you've already submitted it. I want you to change it if you feel like it's needed, because by the end, it should be a complete package. Okay, anything else?
Got a question.
Uh-huh.
So for the objectives within the learning domains, the cognitive, psychomotor, and affective, if I'm doing like a skill-centered education module about portable ultrasound, how would I phrase an affective domain objective? Would it be like something around critical thinking to make a decision based on, or for patient care? Is that kind of more the affective, or is that more cognitive?
Well, I mean, first of all, every skill has all 3 levels. So no matter what skill you're talking about, you're going to have a cognitive level. The understanding, the ability to understand how ultrasound works, right? What is the behavior you want them to demonstrate? Do you want them to be able to demonstrate the appropriate technique in using ultrasound? And is this lung ultrasound, I'm assuming?
Yeah, it's going to be for airway management, like confirming tracheal intubation. And
okay, because lung ultrasound is another area that's growing popularity for respiratory therapists to branch into. But anyway, so the skill you want them to learn then is the being able to perform airway ultrasound techniques. And I haven't done that, so I don't know what all the techniques are. Is there 1 technique, 2 techniques, 3? I don't know. But there's a skill set that goes with that. That's the psychomotor. And then the affective is that, let me go back to this real quick. I want to. If you think about the affective domain, all right, so one of the, so do they see, are they able to initiate ultrasound for a particular clinical case to ensure proper airway management? So that's a behavior, right? Now, you might think of behavior as just being, whether they're good or bad, but a behavior, the affective, are they able to take the initiative? Taking the initiative is an internalized behavior. Does that make sense?
yeah, it does.
Okay, so you're initiating it. It comes from within. It's, if you talk about in psychology, we talk about locus of control. Now, locus of control is either internal or external. External control would mean that you would require some outside force to make you do something. An internal locus of control would mean that you actually have that ability to make the behavior change or express a behavior from within. Now, where does that come from? That comes from your ability to understand, your cognitive ability, right? Now, you may learn that through your psychomotor skills because you internalize it by being able to practice with ultrasound or practice with whatever you're doing. And it becomes in other words, you develop the behavior because you practice, and then it becomes where the person can, and actually anything in respiratory therapy that a new student is learning would be in that category. They're developing that behavior. You can't expect a student to have the behavior at the beginning, but the goal is to get them to that behavior. You want them to be able to initiate the procedure based on their cognitive ability and be able to perform that procedure in a way that's safe for the patient. It's all connected, okay? It's all connected. And that's why I think it's important to look at these verbs to understand which one is appropriate in this case. And not really knowing anything that, I mean, I know what ultrasound is, but I've never clinically used it because when I was clinical practicing, ultrasound and respiratory therapy did not go together, okay? But over the years, it's evolved. I mean, that's the one thing I miss about clinical practice is I don't get an opportunity to do these all really cool things. I mean, I got to do some pretty cool things when I was working in clinical practice, such as single lung ventilation, collapsing down a kid whose lungs on the right side when they had PIE, being able to ventilate the left side, being able to reinflate the lung that was, doing all this, I say fun things, but, interesting things. Having patients that, presented with, diseases that you never have ever seen, and you somehow overcome the problem because even though no one knew anything about it, you just sort of used your skills. So you had to have a behavior that you could initiate, which came from what you already knew. Okay, that's a good question, though, actually. Because I think you have to understand how all these tie together. They're not separate. You can perform a skill, but if you really don't understand it and you don't have the right approach to it, you can do some pretty serious harm. Just like I described about the patients that weren't taken out of standby.
So can one objective cover two different domains?
It's possible, but you want to break it down. Break it down in other words, if you were going to write your objectives, you would use a subheading: cognitive domain, psychomotor domain, and then affective domain. Those are your three subheadings. Below that, write your objectives. You may see some crossover, and it may sound similar, but you have to think about where you want them to be. In other words, you want a professional to be able to act upon those skills, right? You want them to be able to take those skills, perform those skills without prompting. You want them to be able to understand how to do the skill, which is the psychomotor. So you may have some of those crossovers, absolutely. But it probably wouldn't read exactly the same. And if it does, you probably want to maybe look at that a little closer. But again, it's possible that it could cross. It will definitely cross over. There's no question about that. Whether it would be worded the same way might be questionable. Okay, anything else?
Did we decide if we were switching to Mondays?
Yeah. Well, that's up to you. You all are the ones that are coming to class, so you decide. Is it a yes or a no? Because some people think it might work out better for those who aren't coming because they can't come. I don't know.
I would prefer it, but.
Okay. And I think Brandy already told me she would. Kelly, Shandy, Amy, what do you think?
I like Mondays.
Mondays? Okay.
Either one works for me.
All right. Amy?
Same. I'm in either or.
Okay. Well, I can do Mondays. Actually, it would be better for me too. I think I told Brandy this yesterday. I didn't have a clue as to why we chose Tuesday, but it just was Tuesday. So there you go. We'll change it to Monday. So I'll send that out. I'll have to redo the Zoom classes and everything. So I'll be deleting all those, but I've got to get the current Zoom class downloaded and uploaded before I do all that, because otherwise I'll lose this lecture. All right. Well, that's it for tonight. I appreciate your time.
Your microphone was great this time, FYI.
Okay. Hopefully it is, because it was a very expensive one. So, all right. Let's see, where am I? Where's my stop video? And all right, y'all take care.
Bye now.
Bye-bye. All right, where is my? There I am.